The topic for the presentation will be single visit endodontics. The contents include introduction, goals of endodontic treatment, definition, criteria for case selection, myths and facts on single visit endodontics, indication, contraindications, advantages, disadvantages, conclusion. Introduction. The endodontic therapy as a treatment modality to save teeth is gaining importance day by day. Over the years, the evolution in night eye instruments coupled with improved techniques of root canal preparation and precision obturation has helped the operator perform endodontic procedures more effectively and efficiently. The basic goals of endodontic treatment are localization and elimination of microorganisms and their substrate from the pulp spaces, proper chemomechanical preparation of the root canal system, shaping and disinfection, three-dimensional obturation of canal system. Do you think these goals can be achieved in a single visit? Moving on to our topic for today, single visit endodontics. It is defined as the conservative non-surgical treatment of an endodontically involved tooth consisting of cleaning, shaping and obturation of the root canal system in one visit. Criteria for case selection of single visit endodontics as given by Oliot includes positive patient acceptance, absence of acute symptoms, absence of continuous hemorrhage or exudation, absence of anatomical interference like presence of fine, curved or calcified canals, availability of sufficient time to complete the case, absence of procedural difficulties like canal blockage, ledge formation or perforations. As far as single visit endodontics is concerned, there exists a number of myths among the patients, of which the most common ones are as follows. The first myth would be post-operative pain is greater when endodontic therapy is done in a single visit, especially in a non-vital teeth. But the fact is, overwhelming evidence displays that post-operative pain resulting from treatment of vital or non-vital teeth does not differ among the patients who were treated in a single or in multiple visits. The next myth is when endodontic therapy is completed in a single visit, there is less healing, particularly in non-vital teeth. Fact is, 1 year follow-up time is the soonest possible to determine whether or not the lesion has healed. Moving on to the next myth is post-operative flare-up is greater when endodontic therapy is completed in a single visit. The real fact is post-operative pain and swelling are together described as flare-up, which is possibly one of the most perturbing issues that dentists performing single visit therapy need to deal with. Next one is cleaning of canals takes place if an antibacterial medicament such as calcium hydroxide is left in the tooth. But efficacy of calcium hydroxide in controlling bacterial colonization is a controversy. The fifth myth is multiple visit endodontics is safer than single visit endodontics, and multiple visits mean more careful treatment. Fact is, for patients at the risk of contracting bacterial endocarditis, AHA recommends as many procedures as possible during antibiotic prophylaxis. By limiting these patients to single appointment, they are at less risk of contracting endocarditis and of having an allergic reaction to the antibiotic. The next myth is patients do not mind multiple appointments and are likely to object to the fee if the procedure is completed in a single visit. Aside from cost, there are two other major barriers to patients visiting the dentist, a fear of pain and time required. Moving on to our last myth, after obturation, treating a flare-up is complex. Thus, treatment should not be finished at the first appointment. The real fact is, Fear of a post-observation flare-up prevents clinicians from performing single-visit endodontics, but such flare-ups generally are less common than inter-appointment flare-ups. Concluding with the myths, the indications for the single-visit endodontics are as follows. Vital teeth, fractured anteriors where aesthetics is the concern, uncomplicated vital teeth. In anterior teeth, single-visit endodontic therapy is indicated because of aesthetic reasons. Patients who require sedation every time, non-vital teeth with sinus tract, non-surgical retreatment cases, teeth with accidental pulp exposure, medically compromised patients who require antibiotic prophylaxis, physically compromised patients who cannot come to dental clinics frequently. Contraindications for the same would be teeth with anatomical anomalies such as calcified and curved canals, asymptomatic non-vital teeth with periapical pathology and no sinus tract, acute alveolar abscess cases with frank pus discharge, patients with acute apical periodontitis, symptomatic non-vital teeth and no sinus tract, patients with allergies or previous flare-ups, teeth with limited access, patients who are unable to keep mouth open for long duration such as patients with TMJ disorders. In single visit endodontics, the major advantages are it's always convenient for the patient as they need not have to experience the discomfort of repetitive local anesthesia, treatment procedure and recovery. It has better efficiency as the clinician does not have to refamiliarize to patient's particular anatomy or landmarks. Patient comfort. Due to reduced chance of leakage of temporary cements, there are less chance of intra-appointment pain. Use of fewer material makes single visit endodontics cost effective for both operator and patient, whereas it costs more in case of multiple visits. It also minimizes the fear and anxiety of the patient. There occurs lesser errors in working length. In single visit endodontics, immediate placement of coronal restoration ensures effective coronal seal and aesthetics. Despite these advantages, the disadvantages of single visit endodontics are it is tiring for patient to keep mouth open for long duration. If flare-up occurs, it is easier to establish drainage in a tooth which is not obturated. Clinician may lack proficiency to do single visit endodontics. Some cases cannot be treated by single visit. For example, cases with very fine curve, calcified multiple canals and teeth with weeping canals. A consideration to note is single visit treatment should be avoided in vital teeth as collagen pulp tissue at the apical constriction area may create problem in later stages. To conclude, the concept of single visit root canal treatment is based on the theory of obscure or inhume, which implies that majority of microorganisms are removed during preparing and irrigating the canals and the remaining bacteria get obscured or inhumed in the dentinal tubules after the root canal obturation. Such bacteria do not survive long because of lack of nutrition and spacing. The antimicrobial activities of sealers during obturation and also the zinc of gutta percha may kill the residual bacteria. The take-home message is that there is no significant difference in post-operative pain and post-operative healing between single visit and multiple visit endodontic treatment. Thank you.